Now, here we will construct a search strategy. We will now put the application of your keywords and your key concept to the search box. That means this is like the heart of doing the systematic search, and this is the most important part and the most exciting part as well if we will do the search strategy. And here are the must know before doing and encoding that keyword or key concept in the search box. First, we have to identify what level of evidence do we need. Now, talking about level of evidence is also known as the hierarchy of evidence, and we will be discussing that later on. It further explains that what exactly are you searching? What kind of evidence do you want? And they are classified according to the level of evidence. And in our later discussion, we will know what are those level of evidence. That's the first thing first. Second to that, when you want to search, you have to establish the inclusion and the exclusion criteria. What do you mean by that? Inclusion, that means to include. Exclusion, meaning to exclude, meaning what do you want to take and what do you want to throw. Inclusion and exclusion criteria goes like this. If you want to search for a female patient, of course, you will exclude the male, only the female. But what kind of a female are you going to look for? You're going to look for a female within the range of 20 to 30 years old. That is a specific inclusion criteria. And you will exclude those researches that studies the population of beyond 30 years old and below 20 years old. And those patients only who are suffering a specific asthma condition, that would be specific of the inclusion criteria. So you have to know first, you have to type all your exclusion criteria, how many years, okay, of available researches are you going to look for? Are you going to look for the databases or researches that has been published way back 1972, 1945? No. You're going to look back only beyond 5 years. If today is 2021, then you just have to go back 5 years down below. Okay, that is the inclusion and exclusion criteria that you have to do. Okay, so now you're ready to type and encode your keyword. Now, first thing first, let's try to know what is a keyword. Again, let us be reminded. Let's take a look.
Research databases use more precise keyword searching, and most don't automatically search the full text of a resource. Keywords are words or phrases that describe the topic you are researching, and you'll want to use them when searching databases to locate the most relevant resources on your topic.
Okay, so we have discussed what a keyword is in the beginning, and that keyword will delineate or will specify what exactly are you looking for. Keywords are the key concept. Now, once you know your keywords, then you're going to sort for the keywords or concept. The question, how do you sort? What do you mean by sort? Sorting the keywords or concept means you are going to either expand, either limit, and that is not only the keywords, but when you search, you can also search for subject headings, you can also search for the title. Now let's try to know, how do you sort the concept?
Your search question could be, what are effective parenting techniques for an ADHD child? Your key concepts are parenting, ADHD, which stands for Attention Deficit Hyperactivity Disorder, and child. To help in formulating the search query, it may be helpful to break down the key concepts using a concept table. A concept table may look something like this example. Here, each concept is a different color. Using your question, what are your concepts? 1. Parenting. 2. ADHD. 3. Child. What are some other terms for each of these concepts? For concept 1, you may wish to consider parenting or parent. For concept 2, a synonym or alternate term for ADHD might be attention deficit. For concept 3, you may also want to consider other terms for child, such as children, adolescent, or toddler.
Okay, this is very clear here that when you are sorting for the keywords, okay, when you have the keywords or the key concept taken from the clinical issue, originally the word is parenting, ADHD, and the child. If you may notice, you are going to create a concept table. And this table right down below, you are going to find a word that is synonymous with the main word. Now, when I say synonymous, that means this is an alternate term. Parenting is no different from parent, but when you search that, it makes a difference. So whichever will give you the same hits or it will give you the same result, such that of the ADHD. Another word that is similar to that would be attention deficit, or this is the synonym of that. And then the child can either be a word adolescent. So these are the terminologies, and this is what we do when we sort the concept. Okay, so after knowing that the keywords or concept or the subject headings and title can be sorted, be given a concept table and be given a synonyms or the alternate word, then another strategy, okay, for the search is by using what we call the Boolean connectors. Now, as it sounds, Boolean connectors is something strange, something that we never heard before, and this is what we call the jargons of evidence-based practice, the Boolean connectors. Let's take a look and listen as to what is this Boolean connectors.
Once you have your concept table completed with alternate terms, it's time to combine them using Boolean operators. Databases use Boolean operators to combine terms into a search query. In the PubMed database, the Boolean operators must be capitalized. The AND operator limits your search. The OR operator gives you more. It broadens your search. The NOT operator eliminates topics, and it should be used carefully, as it may have unintended consequences, eliminating citations that could be of interest.
Again, mentioned here are the three important Boolean operators or connectors. Again, AND, OR, and NOT. When we use AND, okay, we narrow the search. That means we only look for selective result. And when we use OR, okay, we want some more. And when we use NOT, that eliminates the topic or in any way filters the topic. Let's continue.
Use the AND operator to retrieve the search terms, for example, cats and dogs. The intersection between the two, the purple polka dot area, retrieves the citations pertaining to both cats and dogs. As you can see, the use of AND narrows the search results.
Okay, that's plain and clear. When you put AND in between the two concepts, okay, it's like you are limiting whichever, okay, cats and dogs, every story or every research that you will look for must have a combined information about the cats and dogs, and it narrows the search. Let's continue.
Use the OR operator to retrieve either of the search terms. For instance, cats or dogs retrieves either cats or dogs. Therefore, the OR operator broadens your search results.
Okay, at this point, another connector is the OR. So when you look for a research, it will broaden your the result when you use OR, because the research will give you a story related to cats or the story of the dog. So you have two stories, and when you combine that, it will give you more researches or more evidence because you add or. Let's continue.
Use the NOT operator to eliminate search terms. For instance, cats, not dogs, retrieves only cats. Caution: You will be missing some cat articles that discuss both cats and dogs in the area where dogs and cats intersect. Now let's look at your concept table with the Boolean operators. You can read the concept table from left to right, with each colored column representing a different part of your search string. Parenting or parent, and ADHD or attention deficit, and child or children.
Okay, at the last part, you may notice that there are words or concept that is being connected by or, and at their middle part, the end is being placed between two concepts that has a synonymous down below. And this is the role of connectors. Now, let's take a look at what is truncation. This is another jargon or another strange words that we have not heard before. And truncation, like Boolean connectors, do have their purpose. Now, let's take a look at what is truncation.
Now let's look at a couple of tips that could save you time. Truncation and parentheses. Tip 1, truncation. Using an asterisk truncates a word and allows you to look for variances of a root word. For example, child, asterisk. This retrieves child or children. Tip 2, parentheses. Using parentheses allows you to group like concepts. For example, child, asterisk, or adolescent. In the second example, ADHD or attention deficit. Combine the terms together so they'll be processed as a unit, as the Boolean operators are processed from left to right.
Okay, at this point, we are using two characters. One is the asterisk, and the other is the parenthesis. The asterisk will give you a word that is almost having a similar meaning with the keywords, while the parenthesis will connect all together the concept under one search keyword. Let's continue.
Your search strategy will look like what's at the top of the page. And at the bottom of the page, we would take that search strategy and put it in PubMed in the search box. If you're following these tutorials,
This is exactly how we are going to put the research or the search word inside the search box of a database. And the database is something that we have discussed in our earlier slides. And when we type in the word, we are using the truncation, we are using the Boolean operators, and when we click the search, it will give us an even more broader or a narrower, but exactly fit to the kind of evidence that we want to search. We are now closer to the completion of construct search strategy. Let's take a look at letter G. How do you expand a search? Expanding a search is a way of adding more evidences. If you want to collect more evidences, then you will expand the search. The synonym, the explode commands, and the limiters are the way of expanding search. Let's take a look and
Advanced search options in research databases, such as filtering by date, language, document format, and peer review status, can be effective in retrieving more relevant, precise results.
Okay, so these are the way on how we expand. Second to the last, when we are searching the database, do not be contented with only one database because it may limit the search. The rule of thumb is that in order to have a reliable evidence, then we will subscribe to two type of database. And finally, if you are having problem with the research techniques and strategy, then it will be wiser to ask help from the librarian. As I am saying, the database is the gateway to the evidences, but the technical know-how is the expertise of the librarian is the key to that gateway. So we really have to ask the service of the librarian or the expertise of the librarian. We are now with the step 4 of the systematic search. And this is about how to select an evidence to read, granting that you know how to format your Picot question, you know how to search by using a database, by using a journal. But the problem is, what exactly do you need to find? Search or step number 4 will tell you what kind of research are you really looking for. And the answers to that would be A, you have to pick an article that is closest to Picot. And it will lead us back to how do you format your Picot question. And then after knowing that, because we're done with that, we have done that, we know how to formulate a Picot question. We know how to find the keywords. And then what you have to do for next is you have to classify your clinical question and match it with the study type of the study. Okay, how do you do that? If you may remember, PICO is the main acronym, and the two-letter T are they're just optional. This can refer to the type of question, or some other author are saying it. Another T refers to time. Okay? And in here, we will ask for what type of question have we derived from a PICO. Let's take a look and listen.
We want to figure out what our question type is so we know the best sort of study that will help us. These are the 4 biggies: therapy or treatment, diagnosis, prognosis, and harm. It's all very good to list the types, but it doesn't make a lot of sense, at least to me, until we actually give concrete examples of each question type. So the first one, we're talking about what are the ways that smokers can quit smoking? That's pretty easy. It actually has it right there in the title. That's a therapy question. Now the next one, we're looking at what happens to premature babies once they are school age, and how does being born premature influence their learning? That is prognosis. In the third one, we're looking to compare CT scans with other clinical findings in diagnosing intracranial hemorrhage. Again, that one's right there in the title. Diagnosis. And the final one, in adults, does cell phone use increase the risk of brain cancer? That is harm or etiology. Now, not all questions are going to fit really tidy in each question type, but these are at least the big areas.
Okay, now that we have classified the type of questions, and we have done this in the very first part of our video or discussion, we know already how to classify the question. Now, what are we going to do with that question once we have classified them? We will now match that type of question with the type of study that we will look into the database.
Once you know where your question best fits, that is, what type of question it is, then you can figure out what studies can provide the best evidence. This kind of table is really helpful for that. You can see your question types on the left-hand side here and your study types on the right side. The list starts with the strongest type of study and then moves down to research that's not as helpful for providing strong evidence. So for an example, the majority of healthcare questions tend to fall in the therapy category. These are best answered by randomized control trials. And if you can't find any of those, then you move down to cohort studies. If there are none of those either, then you move down to case control and so on.
Okay, that is clear. Once you get to know what type of question is your clinical issue, okay, then there are corresponding evidence to look for. That's why we will select for the evidence to read. And these are the classification, and they are matched according to the type of questions. And these are what we're going to look for. We just do not search. We search specifically for what we need. Let us say the therapy is the type of questions that we have, what we have to look for. Our research is called the random controlled trials. And as the narrative has been saying, if you cannot find this, then you proceed to the second level, which is the cohort. And then if you cannot find this, then you go to case control. And the last would be the case series. This is step number 4. We have to select the evidence to read, identify the types of evidence, and use the hierarchy of evidence in selection. Okay, these are the 2 last steps of search strategy. This is number 5 and this is number 6. Now, again, I would like to remind you that the skills of clinical searching or systematic searching skill is not an easy task. This is being done by the librarian who has a technical knowledge of doing this. But for those who are not practicing it every day, for those who are not yet familiar in doing this, you will find this as a trial and error process. Nevertheless, you as a student taking up evidence-based practice, you are not expected to perfect this process. However, you are expected to be familiar, and at least to have a basic knowledge on how the search strategy is being actually done. Okay, so here we will organize the citation and we will search the strategy. Now, what do we have to do is that when we classify all of those type of research that we want to know, the keywords, we have used the Boolean Connectors, we have used the Truncation, the Explode, and the limiters, the filters, then what we have to do is to type that in a search box. And what will come out in the search box are all the result of our search, or what we call the hits. And all these results are research findings. Now, what we have to do is when we have the actual research, then we will print it for our hard copy so that you can read it anytime you are free to read. Or either you have to save it in the list. Not only the evidence or the article that you may happen to find, but the rest of all of those that you have found out. You have to save the search history. And in saving the search history, this will allow you to come back again, okay, and find the same results or search evidence that you have found before and retrieve it again. Now, let's take a look and listen as to saving and retrieving searches in CINAHL. There's one particular type of database that we will use, which is CINAHL. So that means if you will search again for another database, then you have to be familiar again with another details of another database. Now, what you are about to see is indeed a difficult process. That's because you are not doing it every day. You are not familiar with the process. Okay, let's take a look and listen.
Hello and welcome to the tutorial teaching you how to save searches in CINAHL so that you can retrieve them later to see your results or keep working on them, whatever you'd like. So you can see here that I have a search that I've already done in CINAHL. The search terms are up here and here are the results. what I need to do, so sometimes when you do a search, you'll see the search history, sometimes you won't, but you do need to see that for this, for saving searches. So go ahead and click on that link if you don't see it.
Okay, you may see the database or the search engine in your computer looking like this. This is the search box. This is where you will type your keywords together with the Boolean connectors, with the truncation. Okay, and then you have to set the exclusion and inclusion criteria from here. Okay, and then once you have completed, then you are going to press the search and this will come out. These are the result of your searches, and these are what we call the hits or the many result. It can be hundreds, it can be thousands, or it can be as limited as just less than 100. Now, what we are giving emphasis here is once you have the research result, what we're trying to know here is how to save it and how to look for the search history, which is here being pointed out. So that when you are done doing this or when you are unfinished, your search history will be an important tool for you to come back to your research and continue your work the next time around. Let's continue.
And it'll show me my search history, what I've searched. And then right up here is where it says Save Searches. So I'm going to go ahead and do that. Click Save Searches. And for this, you're going to need to have an EBSCO account. So if you don't have one already, go ahead and create a new account. And this is one where you do need to, it isn't linked to your partner's username and password. So
okay, we have seen how she saved the search history and that she wanted now to go back again to the search history. Now she's going to log in again, and in this type of database, this is a subscribe or a paid type of database. In your case, you are a student of Chakra University. You have to have an account in Chakra Digital Library. That is in order for you to have a password, in order for you to subscribe or to open up this EBSCO or CNAL. That is, you are going to log again in order to go back to the save search history. Let's continue.
you will need to create a username and password. So I already have one, so I'm going to go ahead and log in. And so now we get to the Save Searches screen. I need to name my search. Sometimes some people like to just copy and paste their entire search right up here so that you know exactly what it was that got searched. You can name it something different, whatever you prefer. I'm going to save it as a permanent search. I'm not really sure why I would want to save it as a temporary search, but there could be. And then I'm going to go ahead and save. And here it is. So I can hit continue, and then I can continue searching. All right, let's go ahead and open CINAHL again so that we can pretend like we're coming back the next day or later that day, whatever, and I want to get back to that search. So the first thing I'll need to do is sign into my EBSCO account again.
Now at this point, she has logged out. Maybe she has logged out 2 days ago, 1 week ago, or just yesterday. And now she wanted to go back to the same search history that she left the last time she was logged in. And then now she is again trying to log in order to look back or find those search history that she made. Now let's continue.
Okay, So now it says, I'm logged in. I'm going to go to my folder. And right now it automatically popped to saved searches. It will pop to whatever one of these items has something in it, the first item on the list that has something in it. So if you had saved articles into a folder, it might pop to that. And so you could click down here to saved searches. It saves them in time order. So I'm going to scroll down to the bottom, and here's that search I just saved. I'm going to retrieve saved search. I'm going to rerun the results. And here I am, back at those same results.
Okay, look at this point. She was able to return back to the previous or to the last, okay, search history that she was able to, that she was looking for. And this is the beauty, or this is the importance of knowing how to save, how to print, how to retrieve. You will not waste time again, and you will not be at a loss looking for the last search evidence that you have found out. Let's continue.
And so that does it. That's how you save and retrieve a search in CINAHL.
Okay, so we have already completed the cycle of systematic search. We have reached the point where you already have and obtained the literature that you want. You were able to print it, so you have a copy to read. You were able to save the article, and when you're done, you log out, and you wanted again to retrieve the history or to retrieve the search history, then there you have it. Step 5 and step 6. Again, the process of systematic search is a difficult task. This cannot be done by an ordinary student that is not familiar with evidence-based practice. Your knowledge here in your subject, evidence-based practice, can be considered as basic. You are not expected to finally do the research, but you have to be familiar on the steps on how it is being done. Again, this is a technical skills by a librarian. Nevertheless, you are being taught on how to do that. Until then, this is where we stop with the systematic search.